The Asia-Pacific is home to the largest number of young people globally, about 750 million, who face intersecting challenges and marginalization. Over 60% of the world's population between the ages of 15 to 24 live in this region. Despite the diversity within this demographic, they share many common barriers, including their sexual and reproductive health and rights, SRHR. The region is experiencing rapid urbanization, and almost half of the region's population is residing in urban towns and cities. The structural dimension of marginalization, combined with poor urban planning, has resulted in wider inequalities in relation to healthcare access, education, and employment, leaving young people, women, migrants, and the elderly at the margins. Meanwhile, a large percentage of the population still resides in rural areas that remain impoverished, facing inequalities. According to the United Nations, Sustainable Development Goals, also known as SDGs, are the world's best plan to end poverty, reduce inequalities, and to tackle climate change. It consists of 17 key goals that provide a shared blueprint of peace and prosperity for people and the planet. The Global Sustainable Development Report, prepared by the United Nations member states at the 2016 High-Level Political Forum, HLPF, highlights key entry points and levers to accelerate the action and delivery of the 2030 Agenda. ARROW believes that the SDGs 2030 Agenda and young people's engagement in the process is key to driving positive change in the region. ARROW and its partners' evidence-based research and the latest key survey report findings from 2020 revealed the following of the situation of young people's SRHR. Lack of awareness and information in comprehensive sexuality education among young girls has adverse effects on their health and well-being, and they continue to face barriers in obtaining contraceptives as well as safe and legal abortion services. Lack of human rights-based approach to achieving gender equality in all civil, political, social, and economic agenda, including the SDGs. Obstacles faced by young people in accessing their SRHR include parental consent, stigmatization of adolescent sexuality, lack of providers willing to perform abortions, gender stereotyping of women's reproductive role, substandard conditions in health facilities, and lack of awareness of the available services. Where contraceptives and abortion services are legal and available, they tend to be provided mainly within the framework of marriage. Adolescent pregnancy remains a major contributor to maternal and child mortality. Physical, sexual, verbal, psychological, and economic violence, as well as trafficking and other forms of sexual exploitation, continue to affect millions of girls and women worldwide. Discriminatory policies and harmful archaic practices like female genital mutilation and child and forced marriages still remain prevalent in the region. There is still a gap arising from young people not being engaged in decision-making processes related to sustainable development at national, regional, and global levels. In the past few decades, some progress has been made in reducing gender inequality, particularly in relation to SRHR. However, despite this progress, many gaps still remain. SRHR is essential for the empowerment of women and to all quality of life issues concerning social, economical, and political participation. Lack of access to SRHR not only impedes the rights of youth's health, but it also makes them more vulnerable to gender-based violence, HIV/AIDS, maternal mortality, teenage pregnancy, and unsafe abortions. The Asia-Pacific region has a significant youth dividend who hold the power to the main drivers of change. Young people themselves are voicing their demands. ARROW's work addresses inequality and violation of sexual and reproductive rights through an intersectional lens to benefit young people in all their diversity. In doing so, ARROW takes into account that oppression and discrimination aggravates young people's lives. All of ARROW's data and research suggests that young people's SRHR is further compounded by religious and cultural moral codes deep-rooted in patriarchy.
I'm Siva Thanendran, and I'm the Executive Director of ARROW. In 2016, we at ARROW had planned for the preparation for the next strategic plan, which was supposed to take place from 2017 to 2021. So in 2016, we were to invite our partners, set out what the regional priorities will look like. And then suddenly when we were planning this process, we were just thinking, hey, what if young people could actually have a strategic plan? Would young people give us a strategic plan that was completely different in terms of priorities and strategies and asks as compared to our usual partners who are comprised of women's rights organizations and service providers? And in line and parallel to the strat planning meeting, we decided to have a youth strategizing meeting as well. And from there, we invited young people and from the organizations they were in across the different countries in Asia to come and tell us what they thought Arrow can provide of value to young people's organizations in the region. And that really made a difference in how we carried out our work with young people and youth-led organizations from that point onwards. For the young people who attended that meeting actually told us that when they were young people inside of the SRHR movement, they were very often given the opportunity to be advocate for young people's rights. But lesser thought has been given to their own development as professionals in the field as well. So some of the things that they really, really valued that what Arrow was doing was monitoring and evaluation, right? So we do monitoring of government commitment to the standards set by the Sustainable Development Goals or the ICPD Program of Action. And this was something they found would be incredibly valuable to them if they could learn these skill sets from us.
One of Arrow's key objectives has been to build the capacity of youth advocates working on SRHR in the region in collaboration with our partners.
My name is Sai Rachella, and I'm the Deputy Executive Director at Arrow. Young people also see the value in terms of capacity strengthening on issues of SRHR, but also on gender, on human rights, issues around the SDGs, whether it is violence against women and girls, whether it is FGMC, which is female genital mutilation cutting, whether it is around harmful practices such as child marriage. So young people see the value for capacity strengthening, learning exchanges on these issues, especially on strategies as to how they can engage. There needs to be strong platforms or youth networks or youth-led and youth-serving organizations who are trying to localize the SDG agenda and trying to keep, when we talk about youth movement building for SDGs, it is bottom-up. It is starting from the localization of the SDGs in the national context through youth networks and youth-led organizations, but also having a space at the regional level in order to have that space where people can exchange their ideas, their strategies, in order to build a stronger movement at the regional level, but also connect it at the global level with the overall SDG agenda review and follow-up processes.
In 2015, many of Arrow's work with young people started off as capacity-building workshops around SRHR in leadership. An internship was organized in early 2016 which focused on sexuality training. In 2017, the focus expanded to include capacity strengthening on monitoring the SDGs and integrating youth issues within the SDGs for SRHR accountability. It aimed at strengthening advocacy capacities and youth-serving organizations to enhance their engagement within the SRHR movement in South Asia.
So my name is Biplavi, Program Director at Arrow. For building the next generation of leaders, we started with the young people's sexual and reproductive health and rights. So now we are in the third phase, but coming to second phase, we actually moved to be more focused on comprehensive sexuality education and with the intersectional lens. And when I say intersectional lens, at that because Arrow already works on intersectional issues or interlinkage issues of interlinkages of SRHR with other issues. So, but at that point of time, what we realized is that, building the understanding of sexuality as a multidimensional and intersectional concept and from a very sex positive or affirmative lens, and it is necessary. And we really need to build this as a frame of analysis in our work. When we are talking about sexuality, when we are talking about sexual and reproductive health and rights, we are talking about it in a more holistic manner. Because young people's sexual and reproductive health and rights is impacted by so many other things, like religion, your culture, and your your caste systems. Then there's so many other factors, like if you are in a conflict situation that has a different, so it's so diverse. This also recognizes young people are not a homogeneous group, they are very heterogeneous, and so are their needs. So we have to, if we really need to make an impact on this, the intersectional lens is really, really important. If we are talking about sexual and reproductive health and rights, it has to be the young people who has to lead it, who has to be at the center of it, and who has to also take it forward. And that's where we said that, okay, then what should be our next step is to really build the capacity, right? Or first identify and then build the capacity of youth leader, not just as an individual, but also as organizations. We are really focused on the youth-led and youth-serving organizations. So, and we partnered with 8 organizations, started with the training on sexuality, sexual and reproductive health and rights, and then moving also towards how to build their capacity as an organization, financial systems, the operation systems. So we actually really supported in that form as well. So some of these partners are now also moved to Writer right now. I'm sure this is another initiative, which is a much bigger initiative.
Through the Right Here, Right Now initiative, regional gatherings such as the Asia Regional Fora have been bringing together youth SRHR advocates from the region on an annual basis since 2017.
This is Naumina Choudhury, and I am working at Arrow as a program manager for this program called Community Mobilization for Sexual and Reproductive Rights Accountability. So for the Right Here, Right Now project, it's a very interesting project because it brings together a combination of partnerships. So on the global level, you have Arrow working with other global partners like Rutgers, Choice, Dance for Life, our partners in Latin America and the Caribbean, and we also have partners in Africa. So on the global level, you have that sort of a partnership existing. And we each actually come in with different roles. So for Arrow, we do obviously focus on project implementation in the countries that we are working in Asia. But another important component that we bring in is capacity strengthening of youth advocates working on sexual and reproductive health and rights in each of these countries. So in the country level, you have this combination of youth-led, youth-serving, and traditional rights-based organizations who have come together, joined together by a common cause to advance the sexual and reproductive health and rights of young people. So that's one of the unique aspects of Right Here, Right Now partnership. So our earlier events, workshops, trainings, etc., they all concentrated on value clarification, say sexual and reproductive health services. What does it mean when we say that a service is inclusive? A service is something that is free from all kinds of barriers or discrimination. Difficult topics like comprehensive sexuality education. I mean, talking about sexuality in the countries that we work in itself, it's a challenge, right? I mean, it's a topic that's not easy to navigate. Another unique aspect of Right Here, Right Now was bringing together all these youth advocates in a common setting so that they were able to exchange what their country context was with relation to comprehensive sexuality education. What are the challenges? And the way we overcame those challenges is through those exchanges, because then they learned from each other, through these sharing of country context. They were able to share what the challenges are, what the solutions were. And as a group, they were able to reflect on what could be like the big solution to move things forward. And that all stemmed from clarifying their knowledge on what is actually meant by each of those concepts. So it's a different experience when you work with young people and you include them within a particular sort of initiative. And Right Here, Right Now did exactly that. It worked with young people to make all that happen, and the journey continues. I mean, this year we did a regional fora. We couldn't do it offline. Usually we do it in a common space so everybody can see each other, and it's always fun to do it that way. But this year, because of COVID, we had to take things online. But because of COVID and how the world has changed since then, we basically tried to, instead of doing value clarification exercises on other SRHR related concepts, we focused on youth mobilization. So what does it mean when we talk about youth mobilization, youth movement building, and how does that play out in the post-COVID scenario? So we try to keep the capacity strengthening very practical, because it stems from that belief that, you know, it's young people we're working with, and they are the drivers of change, and they have the power to really bring that positive change within the community that they live in.
Bringing young people's voices and concerns to the regional and international advocacy spaces has been a core activity of Arrow and Right Here, Right Now initiative. Over the years, Arrow has supported the participation of youth advocates in various UN monitoring processes, including key subjects like human rights accountability and SDGs. Each of these interventions has strengthened the voices of young people from the Asia Pacific while allowing scope for sharing of experiences.
My name is Shamla Chandrasekharan, and I'm the Advocacy Manager with Arrow. So as part of Arrow's focus on advancing young people's SRHR, we anchor our advocacy work in several global key advocacy spaces, and this includes the High-Level Political Forum, the HLPF, and also the Human Rights Council, HRC, where we work closely with the young people, the youth advocates from the region, including from the Right Here, Right Now program, to actively shape youth advocacy, where they engage meaningfully and effectively to both directly and also indirectly influence decision makers and stakeholders to support and implement actions for the fulfillment of the SRHR of the young people, especially around issues concerning comprehensive sexuality education, youth-friendly SRH services, abortion, and SOGI rights.
Assalamu alaikum. My name is Julie Khan, and I'm a transgender woman, and I live in Pakistan. I started my movement 5 years ago when there was no any right, there was no any conversation about the rights of transgender persons. So I raised my voice against Section 377, which was the sodomy case, and transgender rape was not considered as a rape. Later on, I was also the SRHR advocate, and I advocate for the rights of sexual and reproductive health rights of transgender persons. I was also the part of Transgender Protection Act 2018, in which we have the right to health, and which was very progressive step against the SRHR rights of transgender persons in Pakistan. As you know, when the British came to the subcontinent, the colonial law came to the subcontinent, they introduced Section 377, which was the sodomy case. Sodomy case is the thing that the transgender rape of the transgender person is not considered as the rape. He or she will also considered as a criminal. People were not aware, even public do not have that concept that transgender persons are also being raped, and their rape is also a rape, and the culprit should be behind the bars. So I raised my voice against that Section 377, and I raised my voice to abolish that section. We advocate to the stakeholders and to the institutions. So they acknowledge it, and they ask that transgender rape is rape. And in 2018, we got a proper act in which transgender rape was considered as the rape. And because in Pakistan, people do not care and do not think about the sexual and reproductive health rights of transgender persons. And as you know, when the transgender person gets into the puberty age, she or he have many concepts, many fears, and when she or he do not know about their gender identity, and they do not know even how to behave and how to react and what to do and where to go. If there is any sexual and reproductive health issue, transgender persons are not allowed to go to the hospitals. Because when we research and when we research to the doctors, we come to know that in the doctor learn MBBS curriculum, and when they go to the higher degree and they get the degree of MBBS curriculum, there is no any subject or no any chapter or no any topic of transgender persons. So doctors claim if we do not learn about it, if we do not have information about the transgender persons, how can we do the treatments to them? So that was the issue when we advocate that in curriculum of MBBS, the chapter of transgender persons should be included, so that doctor will know that what is the issue of transgender person related to their sexual and reproductive health right. Because in Pakistan, because we do not have such doctors and clinics, transgender persons are doing self-medication. They are doing hormonal therapy. They are doing self-medication. They are not subscribed to the doctor. In result to that they have many complications. They have different kind of diseases, which is HIV, which is hepatitis, and other diseases, just because we do not have the proper medication for our gender identity and our hormonal therapies. The Arrow play a very important role because the project right here, right now, actually have a very positive impact on our lives, because before that, no one talk about the sexual and reproductive health right of transgender persons. So when we have that project, we are able to advocate with the doctors. We are able to find the gaps and challenges by which doctors are not communicating and they are not properly check the transgender persons. So I think it is very, very much important thing for us, because as I told, the transgender person in Pakistan are doing self-medication. But having that project, but having that sensitization sessions and all that things, the discriminatory behavior of doctors and the staff of hospital is changed, because we go to the hospitals and we advocate with the doctors, we advocate with the nurses, and we advocate with the staff of the hospitals in Quetta, in Islamabad. So they are now willing to give us the treatment without any discrimination of gender, without any discrimination of our gender identity. By this project, now we are able to have our sexual and reproductive health rights. Although there is very much work to done, but still now the things which are done in last years, they have a very positive impact. And as I told you, in Transgender Protection Act, which we got in 2018, we have a segment right to health. And in right to health, our sexual and reproductive health right is the main important segment. So when government is giving us that right, it means that it is a very big step for us. And now we don't have to do the self-medications, and we don't have to get into the different diseases. We just have to go to the doctor and consult to him or her and told our issues. And doctor will not discriminate us. When I go to the Asia Pacific Forum, it was a very learning opportunity and very learning platform for me, because at there I realized that we have to done something for our community. And by the SDGs 4, 5, and 6, which is mental health being and gender education and quality education, they are very much important for us. And it is a very big step for us, because we got the right, we got the act, and then we have the SDGs, where we talk about the gender equality, where we talk about the quality education, and where we talk about the mental health and well-being of transgender persons. So I would like to thank you to right here, right now, for being such a productive platform for us. And I think so that there must be other projects, and there must be other like that things in which we can get our rights, which will be acknowledged.
Hi, I'm Saja. I'm from Nepal. I got to know about this organization in Nepal called YUVA, which works for young people's sexual and reproductive health and rights. And I got this unique opportunity to work with them, get engaged with them. And the more I engaged with them, the more I knew about the issues of young people. Being a young person myself, I was unaware about the fact that these were certain problems that even I was facing. But once I got with YUVA, I realized the enormous amount of issues, including the sexual and reproductive health and rights, that young people were facing. So being engaged in these advocacy spaces, especially regional spaces and international spaces, is very important, because it allows space for us to ensure that our governments are, doing the things that they claim to do. And as a young person, engaging in achieving the sustainable development goals is very important, because these government officials, whatever they do, and that directly impacts us as a young people, because eventually we will live the life under the policies, under the strategies that they formulate. So I think having our say and having our equal participation is very, very crucial. At national level, I have been engaged with different civil society organizations which are leading the discussions on the sustainable development goals. The reviews are taking place. I've been part of those, and in the regional level, I have been engaged at I've already shared the Asia Pacific Forum on Sustainable Development, which takes place every year. And definitely moving forward, I'll be working a lot at the community level so that I am able to bring change at the mindset of people, not only young people, but those who shape their lives, who the enabling environment, I think, where they are in. And also at the policy level, because definitely if we bring policy change, that will go throughout the country. So that will be the focus.
My name's Noor Imran. I am 29 years old. I started working in 2015, so around almost 6 years now. I basically got the opportunity to also participate in the high-level political forum that happens in New York for the review of the Sustainable Development Goals. And Pakistan was not having its review that year, but I was able to, with help from Arrow, I was able to have a meeting with the mission in Pakistan, and we went to him and we asked him why Pakistan is not getting its review done, why Pakistan's late in the region to get its review done, what's the progress on these sustainable development goals for Pakistan. So that was again a way to legitimize this youth movement, because a young person was able to go to Pakistan's mission in New York and question them about Pakistan's progress, that why aren't we participating in this? Why is this not being done? At the regional level, the Sustainable Development Goals are monitored by United Nations in Bangkok, UN SCAP. And that mechanism happens in Bangkok, Thailand every year. And I was able to, along with other young people from the Right Here, Right Now Network Pakistan, we were able to participate in a pre-APFSD, Asia Pacific Forum on Sustainable Development that happens in Bangkok in the UN SCAP office. A document that we formulated with collaboration from young people from everywhere, not just the South Asia region, but the East Asia region. Everyone was there. And we developed this document, and then we also participated in the actual forum for civil society. Youth has since been given a constituency. They're given special representation as a separate constituency. They're recognized. You see, at the final Asia Pacific Forum for Sustainable Development, Right Here, Right Now Network was able to get a young person to speak for a young person. So again, that's a huge thing that legitimizes your entire movement. There have been so many forums that I have been a part of, and not just been a part of in the sense that I was just there. I've been actively involved in those forums, drafting statements, delivering statements, trying to do my part in the advocacy as much as I could. And again, that is also translated back home. So what I liked about the entire RHRN network, the Right Here, Right Now network, is that it wasn't just something that was happening on ground at a national scale. It was happening at whatever scale we could reach. We were trying to do this nationally, we were trying to do this regionally, and we were trying to do this internationally. We would not want to miss any opportunity, and give young people that opportunity to basically interact and know what's being done for them, and have a say in it.
UNESCO notes that CSE is needed to promote health and well-being, respect for human rights, gender equality, and to empower children and youth to lead safe, healthy, and productive lives. Arrow recognizes that comprehensive sexuality education not only includes knowledge on menstruation, pregnancy prevention, and safe sex, but also understanding bodies, boundaries, respect, and consent. Arrow has been working tirelessly with our partners who have provided national research and evidence to substantiate a regional brief that documented the status of CSE implementation within Asia. It draws specifically to 11 countries from South, Southeast, and Central Asia, analyzing the laws and policies on the status of CSE while presenting the gaps, challenges, and recommendations on its implementation. Given the challenges related to the implementation of CSE in the Asia-Pacific region, ARRO's multi-stakeholder dialogue on CSE took the form of a biennial gathering bringing together youth activists, advocates, CSOs, and NGOs working on CSE. It also includes UN agencies and government representatives of 15 countries in the region to have a focused discussion on the implementation of CSE and the need to make that available from the early stages of learning. ARRO has also been holding youth festivals that provide a space for linking and learning through creative expressions and other mediums of advocacy. These festivals are a safe space where youth's demands, concerns, and hopes for their SRHR are conveyed through songs, art, poetry, dance, monologues, and photo exhibitions. These youth festivals have been arranged through the collective effort of other youth-led and youth-serving partnerships working on young people's SRHR. Advocates and youth activists are all linked digitally, and together they form the unified voice of the region, committed to advancing their SRHR and holding their governments accountable. Improved well-being of young people through their SRHR are at the heart of ARRO's work and dedication. The various strategies of our work have helped shape important developments in the region where young people have taken the helm to steer positive change for their well-being starting from the community level. Some examples of the added value of ARRO's work on youth capacity strengthening, movement building, and partnership to advance young people's SRHR on the country level includes integration of the life skills-based education in the primary curricula in Pakistan. The Provincial Curriculum Councils and Curriculum Board of the Department of Education of Punjab and Khyber Pakhtunkhwa provinces signed Memorandum of Understanding with the Pakistan Platform to integrate LSBE by 2020. Moreover, the Department of Education in Sindh and Balochistan provinces allocated a budget for teachers' training on LSBE in 2020. In Nepal, through the lobbying efforts by young people, the Family Welfare Division and the Parliament formulated national regulation and directives for safe abortion services that are youth-friendly and free from stigma.
Hello everyone, I'm Mida Sharma, President of Visible Impact, a young women-led organization in Nepal. Through our partnership with ARRO, in the last 4 years, we have witnessed their commitment towards meaningful and inclusive youth participation and their passion to do that through capacity building. With their support, young people in Nepal have been able to meaningfully lobby with Family Welfare Division to formulate a national act and its regulation for youth-friendly and stigma-free safe abortion services. Also, the political willingness of the policymakers and civil society organization for this issue has increased at the national, provincial, and local level.
Another stunning outcome is the work of Indonesian youth SRHR advocates and other allied groups' efforts to prevent the Ministry of Justice and Human Rights from criminalizing gender and sexual diversity as well as consensual sex in the Penal Code.
I am Naura Nabil Haryanto and I'm from Indonesia, and I've been contributing to the fulfillment of SRHR for Indonesian young people through the work of Rutgers WPF Indonesia as the project officer and right here right now focal point. The mobilization of Indonesia's youth advocates for SRHR issues and other allied groups has succeeded to put youth at the forefront of the development of out-of-school comprehensive sexuality education and monitoring instruments for adolescents' health host services together with the Ministry of Health. This collective effort is a proof that Indonesia's young generation can move forward to the next milestones, which is influencing decision makers to include CSE into our national curricula as the long-term investment for Indonesian society.
In Bangladesh, youth SRHR advocates have formed a coalition of intergenerational feminists to come together and collectively stand against all forms of sexual and gender-based violence amidst rising hate crimes against women in the country.
Hi, this is Sarwan from Bangladesh. Recently, SRHR youth advocates and gender rights activists came together in building a platform for all feminists across generations to protest against ongoing cases on gender-based violence, but specifically perpetrated against women, girls, and adolescents. and they are demanding gender justice for those survivors and victims.
According to data from government's One Stop Crisis Center, between 2001 and July 2020, only 3.56% of cases filed under the Prevention of Oppression Against Women and Children 2000 Act have resulted in a court judgment, and only 0.37% of cases have ended with convictions. ARRO's work with young people is a continuing process, and the nature of our work has evolved over the years with changing contexts. With the COVID-19 pandemic threatening young people's SRHR and advocacy, the ARRO Right Here, Right Now Asia Changemakers program was developed as a 5-week social entrepreneurship project for young people from Bangladesh, Indonesia, Nepal, and Pakistan to become effective advocates. The program aimed to build a community of young changemakers. It included capacity-strengthening elements to create a progressive social change that would sustain the post-COVID-19 setting. The strategic direction of program implementation was based on 3 I's: inspiration, innovation, and implementation. At the end of the 5-week program, 40 participants pitched their innovative ideas around youth and SRHR in their respective fields to translate it onto action.
My vision as an advocate of SRHR, especially for Asia Pacific region, is to collaborate with local representatives, stakeholder, policymaker for the easy access of SRHR services to every single individual, regardless of their sexual orientation or any other forms.
Hi, I'm Giska from Indonesia. I hope that international and youth community can be more serious and concerned about SRHR so we can get a comprehensive sexual education and we will have a better life and a better future.
Hi everyone, my name is Danish Tariq and I'm 22 years old, youth advocate from Pakistan. Young people are the critical stakeholders for the decision-making processes for any country.
Namaste, I am Lyusha Tuladar from Nepal, and my vision and commitment as an SRH advocate is that I will continue to work to bridge the gap existing between the young people and their access towards SRH information and service. Thank you.
In the end, what we hope and strive for is a health, growth, and prosperity of youth, especially women and girls everywhere.